signs that the family members have left. Don't forget, my mother's head of the bed should be 30 degrees up at all times. Don't dismiss those signs. They're signs from your directors and things like that. So, let's see what else we got here. Okay, let's talk more about the communication when it comes to specific skills. Let's say we talked about ambulation. And let's talk about some general guidelines that's always going to be. Knock, greet, privacy, safety, side rails. Remember that. Knock, greet, privacy, safety, side rails. You want to knock, you want to greet yourself, and then you want to provide privacy. Before you touch the patient, you want to lock the wheels. Make sure you don't want to touch a patient or move them over and the whole bed flies over and you fly over with it and the patient. So make sure of that. So you want to refrain from touching the patient until your hands are clean. General precaution. And you also want to clean your hands after every skill. Do not place the bedpan directly on a bedside table. And let's say catheter care, you want to make sure in all water skills you want to use a clean basin. Right, again, don't forget, this is part of communication. You want to announce, you want to knock, you want to avoid addressing individuals as honey, baby, sweetie, daddy. Yeah, that's inappropriate. Use their surname like their last name. You also want to ask them about privacy curtains after you leave. There's a few things before and a few things after. And that's a part of safety which we'll get into tomorrow. Let's see. When you leave the resident and during care, make sure you have them covered up. Ask them if they feel okay, if they feel nice and warm. That's another thing too, if they feel cold. Always leave their call light. This is their communication to the world. If anything is so important to orientate or to teach someone when they are in the bed or they're new to the facility, is how they call us. So you want to make sure they know how to use their call light button. Make sure their call light button is within reach. Make sure it's not on the floor, and make sure it's visible and noticeable to them. Let them know where it is before you leave, and also during care. So let's talk about changing their bed while it's occupied. Every time you turn them, touch them, before you turn them, you want to tell them what you're doing. Okay, and you want to give them a signal. On 3, I'm touching your hips and your shoulders. Let's turn. 1, 2, 3. So you want to turn. Please don't forget to pull the bedside curtain, to pull the curtain before you get started. And again, lock their wheels. Feeding. Another social, personal kind of skill. And so one thing that's one of my pet peeves is to make sure that that person has, ask them if they want a bib around them, or what we call a clothing protector. We don't call it a bib. That is not appropriate. Again, refrain from saying honey, and you want to talk to them. You don't want to talk to them like a child either. Just respect them as an adult. But also is that you tell them what they're eating. You don't just make it a big shake and mix it all together. Maybe they had I'm sure they had a lot of pride in what they ate, or even separated their food, and then you get over there and just mix everything together. There's also other comfort measures that have a lot to do with communication, like foot care. You want to make sure that the temperature is fine, so you want to touch the water and you get them to touch the water. Avoid placing clean linen and dirty linen together. They shouldn't be on the same table, and they should not, dirty linen should not be on the overbed table. Find another place for them. And if you get in a situation where you absolutely don't have anywhere to place them, make sure they're in a moisture-proof bag, trash bag, and if you have to, put them, like, let's say, on the shower floor if you need to. Another personal skill that you're close with is mouth care and denture care. During the procedure, there are checkpoints when you might want to make sure that you're not brushing too hard. So you want to ask if they're okay. Minimize exposure as much as possible when it comes to their private area or just covering them, period, because the lack of body fat can, or body fat layer can cause the feeling of coldness. And transferring and walking, want to make sure that their shoes are on, they're sitting upright, and then like I said, there are checkpoints when you want to make sure that they're okay. Like you put the gait belt on. You put the gait belt around their waist, but sometimes it kind of comes up to their diaphragm, and that's how they breathe. So when you sit them down, you want to immediately get that gait belt off, because you know they kind of got to breathe, and it's moved around. Alright, so now I'm going to just kind of go over some of the things we discussed. So we want to greet the resident, address them by name, introduce yourself, provide explanations of why you're there, and explain during the care. Ask the resident for their preferences during the care. Use standard precautions and infection control measures when providing care. Ask the resident about comfort and needs during care, before care, and even after, before completing. Promote residents' rights during care. Promote residents' safety as well during care. Don't forget to always use standard precautions. So, as I was saying, the evaluator will be testing and watching you on how you communicate with the patient, your body language, and how you handle yourself. And part of that, don't forget, has a lot to do with standard precautions as well, safety. Remember, knock, greet, privacy, safety, side rails. Part of safety is side rails. Part of safety is making sure they have their call light. Part of safety is making sure their wheels are locked.